Good afternoon, everyone. Thank you for being here again today. I'm Andrew Rand, Chairman of the Peoria County Board. Teeing off this afternoon's daily briefing on behalf of Chairman Zimmerman of Tazewell, Chairman Krug of Woodford County, and our mayor here in Peoria, Mayor Jim Artis. Thanks again for being here. We have some additional conversationalists for you today after Monica's presentation. Kaylee, Drea from the Neighborhood Enhancement Coordinator position at the City of Peoria, and Becca, Cottrell, Sustainability and Resource Conservation Educator from the county. And then, of course, they'll have an opportunity for a Q&A. We've had a lot of stuff going on, I think, since I was able to last meet with you last week. Probably one of the most important things I've seen occur has been the widespread plan to distribute COVID testing throughout communities across Illinois. When Member Gordon was here last week announcing the governor's decision to provide Heartland Community Health Clinic the testing kits, there was a lot of buzz, a lot of work, a lot of radical restructuring of people's schedules, but I'm pleased to report that that process began yesterday at the Kroger site in the East Bluff, where Heartland has a large primary care clinic serving that neighborhood. And there is a schedule of testing that will roll out that will include a maximum of 3 locations plus weekends, and one of those locations on the weekends will be right here at the City County Health Department. And I look forward to dropping in to see how well that process goes. As of 3 o'clock today, 150 tests were performed at the Heartland East Bluff site, and that means we maxed out the number of test kits available. The question about pent-up demand, or what is to become of the demand if it increases, it is Representative Gordon's intention, Sharon Adams, the CEO for the clinic, Dr. Stoner, the medical director for the clinic, and of course, Director Hendrickson here, to open up those other sites on schedule. Each of those sites will have the supplies to do 150 tests at each location. So clearly the pent-up demand is here, and some of the conversation around who is eligible and who may not be a preferred eligible, Monica will get into here after I stand down. But it is a curious question for many. I think someday we'll be at the point where we won't have to ask or assign any limitations to the testing, but we're not there yet. I want to thank everyone at Heartland Clinic, Dr. Stoner, Sharon Adams. I happen to be the chairman of the board of Heartland Clinic, in full disclosure, in case that isn't known. I'm extremely proud on 2 levels, publicly as a public official and certainly as a private nonprofit board member for Heartland. They have done their level best to maintain operational continuity at their clinics throughout the city and in Pekin, as well as take on some new demands, including providing the site and the people for COVID testing through Jahan and the governor's office's work. So they're doing a great job, and I think we should applaud them. And folks, remember, just check your websites, call 211 if you have questions about eligibility. The City County Health Department website will clarify that too, and that information will be on their website. Monica Hendrickson is next. Welcome, Monica. It's good to see you again, and congratulations on the success of your testing programs.
Thank you, Chairman Rand. Good afternoon. We're going to begin with announcing the to-date totals for the Tri-County region. For the Peoria, Tazewell, and Woodford area, the confirmed cases now sits at 84. Today, the state released the highest single-day increase at 2,049 cases. In terms of Peoria, the confirmed cases are 46. Tazewell County is 27, and Woodford County remains at 11. Overnight, we did not see any additional cases of deaths, and so we still remain at 6 for the Tri-County region. Specifically for the Peoria values, of the 46 individuals, 29 have recovered, 8 are at home and isolating, and 7 are hospitalized. 59% are females, and again, the 3 largest age groups in which we have cases are 50 to 59, 60 to 69, and 30 to 39. Currently, 65% are white. In terms of hospital data, reporting for OSF St. Francis Medical Center, Unity Point Health Methodist, Proctor and Pekin, the total number of ICU beds in use is 18. 10 of which are for persons in the ICU, and 8 for those confirmed with COVID. Non-ICU beds are in use are at 29. As Chairman Rand mentioned, we did want to clarify some of the kind of quick changes that have been coming through from the state in regards to the community-based test sites that are found in McLean County, as well as those test sites run by federally qualified health centers, which includes Heartland Health Services. Previously, there had been 4 groups of individuals that were prioritized for testing. Those were individuals that lived in temporary shelters, those who had a known exposure, those that were older with chronic conditions, as well as those essential service providers. Moving forward, for the federally qualified health centers such as Heartland and those community-based test clinics, the prioritization for testing only exists as that you have COVID-like illnesses. So as part of the press release that was just sent out, the focus is going to be individuals that are 18 or older that are able to administer or self-administer the test. This does not mean that we're asking them to actually do the test on themselves, but they do not need any assistance in terms of doing documentation as well as having a nurse do that procedure on them. So again, 18 or older and have COVID-like illnesses is going to be those requirements for the testing sites. And just a reminder, in terms of COVID-like illnesses, that's a range of symptoms that include anything from fever, cough, shortness of breath or difficulty breathing, chills, muscle aches and pain, headache, and sore throat. So all of those would be considered symptoms or COVID-like illnesses. So again, really excited by the fact that as testing sites go online further and further, the expansion of testing is no longer just prioritized, but now we're seeing more generalized testing throughout various community groups. So with that, I'd like to talk about community in general, and especially since today is Earth Day, and talk about how our neighborhoods and our communities are working towards that. And so our first speaker from the Neighborhood Enhancement Coordinator for the City of Peoria is Kaylee Drew.
Thank you, Monica. Happy Earth Day, everybody. Today, April 22nd, marks the 50th anniversary of Earth Day. Since 1970, volunteers have been cleaning up our neighborhoods and communities, united by a common goal to make our world a cleaner, greener, and more beautiful place. We at the City of Peoria Community Development Department are committed to making the dream of a cleaner, greener, and more beautiful Peoria a reality. While this Earth Day might look a little different than years past, I'd like to take this time to highlight a few programs the City of Peoria, in conjunction with several community partners, plan to offer this year. Before I get ahead of myself, I want to make it very clear that our department and our community partners are very committed to working with public health officials at the Illinois Department of Health and the Peoria City County Health Department to ensure that this year's events keep Peoria both beautiful and safe. We prioritize the health and safety of our volunteers and neighborhood groups above all else. And because our public health officials are learning more about this novel virus every week, I just want to be very clear that these dates are subject to change based on guidance that we receive from these public health officials. If that should happen, we will be sure to communicate that any date changes on Nextdoor, Facebook, Instagram, and through local media outlets. Starting Saturday, May 23rd, the 2020 Tireless program will launch with the help of GIMAX. Used tires can serve as a nesting ground for mosquitoes and other disease-carrying pests, and Illinois produces 14 million used tires every year. So this isn't just a local Peoria problem, it's national, it's statewide, but luckily here locally we have the Tireless program. This program allows City of Peoria residents to drop off 10 tires for free at GIMAX on usually it's the 4th Saturday of every month, starting in May going through October. And that program is from 9 a.m. to 11 a.m. This program is offered to City of Peoria residents Again, the fourth Saturday of every month typically, but you'll want to check our website, appreciatepeoria.com, just to double check. Usually the Great American Cleanup is hosted by the Community Development Department in partnership with Keep Peoria Beautiful on the last Saturday of April. This year, due to COVID-19, the Great American Cleanup has been rescheduled for Saturday, June 27th. If your neighborhood or community group is interested in participating in this event, we encourage you to contact Keep Peoria Beautiful at keeppeoriabeautiful.org to sign up. On the day of the event at 8 a.m. at Glen Oak Park, they will be providing trash bags, yard waste bags, and gloves for any group that signs up with them. They'll also be providing electronic recycling at Glen Oak Park that day. So that's all the electronics that normally are not able to get rid of, like TVs, fax machines, and microwaves. They'll have a trailer there, and they'll be able to take that away for you. Now, if your group is interested in reserving a landscape or trash dumpster at your cleanup location, you can contact the City of Peoria Community Development Department at 309-494-8600. Starting Saturday, July 11th, the City of Peoria Community Development Department will be launching our annual dumpster program. This program allows us to offer 2 dumpsters per weekend to neighborhoods and community groups looking to make a difference in their neck of the woods. To reserve a dumpster, please reach out to us at 309-494-8600. While we can't participate in community cleanups this Earth Day, we encourage every property owner to spend some time this week and every week, ensuring that their grass is cut and picking up any loose litter or debris in their yards. And of course, after touching that loose litter and debris, avoiding touching your face, and of course, washing your hands. Important advice even when we're not in the middle of a pandemic. We know this Earth Day might look a little different than years past. We may not be able to clean up together, but we are all in this together. One planet, one nation, one state, and one city. It's the only one we've got, and we all have to work together to make sure it's the cleanest, safest, and most beautiful place it can be.
Thank you. Our next speaker is from the Peoria County Sustainability and Resource Conservation Educator, Rebecca Cottrell.
Thanks, Monica. Good afternoon and happy Earth Day. As we shelter in place, I think it's important that we're still able to celebrate Earth Day. It's something, of course, Earth Day is every day. We all know that, right? So although we're celebrating the 50th anniversary of the first Earth Day today, and it does look different, as Kaylee said, it's still an opportunity for us to reevaluate what we're doing in our daily life and maybe make a few changes. So a few of those things that I highlighted, making sure that we fight food waste, food scraps. Food goes to the refrigerator sometimes to die, so it doesn't get used. We don't eat our leftovers. So making sure that we are planning with our food scraps, our grocery shopping, making sure that we plan our shopping list, plan our meals, so that we don't have as much waste in the refrigerator. If you do have food waste, composting, it's a great time to get started as we're all at home. You can start a compost bin in the backyard. If you are space limited, there's always vermicomposting. You can visit a few sites that we have. Wanda the Worm on Twitter is a county-sponsored site, and that will teach you a little bit about vermicomposting. You also could visit the Extension site, the University of Illinois Extension, their website for composting information. We can start to plan a garden as well, as many friends and family members that I've talked to are really committed to starting a garden this year, and that is exciting. It's something maybe we could do every year. This year we can really make a larger garden so that we're providing food for ourselves and also perhaps to donate later in the season. If you're running out of things to do with the kids, which seems to happen, some people, you can always pick up some of those classics. You can download the Lorax or the Giving Tree. WALL-E is another one. Also videos that go, or movies that go along with the Lorax and WALL-E. One of my personal favorites is The Wump World, so you could do that as well. If you don't already subscribe to curbside recycling, it's available in most of Peoria County's communities, and several of Tazewell County communities have drop-off facilities or curbside recycling available. In the city of Peoria, you can visit Peoria Picks Up website. You also could visit the county's website, which is peoriacounty.org/recycle, and that will get you to a list of drop-off locations for recycling electronics, as well as getting signed up for curbside recycling. And again, although it looks a little different this year, there are many things that we can do every day. Getting rid of single-use items is probably one of the most important things. So skipping those single-use antiseptic wipes, grabbing a microfiber and some cleaning spray might be a great start. Skipping straws, taking a look at some of the items that you're generating every day at your house now that you're home with all of your garbage that you're generating, instead of it being at school and at work and at the local fast food place. So now that you're home with all of your waste, you can really start to evaluate and find ways to reduce and reuse. So happy Earth Day, and thank you very much.
Thank you. Do we have any questions for our two speakers? For which one in particular?
I'm not sure.
You City of Peoria? Did you know who you wanted to speak to, or?
Yeah, it's about kind of a lot of the litter and in terms of gloves and sanitizing them.
Which one of you guys want to take? Kaylee, you want to take that one?
So with everything going on with coronavirus, I feel like when you go to the grocery store, or even just walking around outside, you see a lot of either gloves on the ground, disposable wipes on the ground, because people are being told to use and wear those things to stay safe. How do you balance that with making sure that you're not necessarily always kind of producing so much waste and making sure you dispose of it properly?
Sure. So I'll start by trying to repeat the question. I know we've noticed a lot of gloves and disposable masks kind of littering the ground as people are encouraged to use those while they're out and about. So one of the things that we tried to do long before this pandemic was place trash receptacles in front of those grocery stores, in front of those restaurants where you might be doing a curbside pickup. So we do encourage people to use those, try to hold on to them and throw them away then and there. And this might be stepping on Monica's toes a little bit, but in terms of the gloves, it's the same as just your bare hands if you're using the same pair of gloves to touch all of the things. In order to prevent cross-contamination, you're really going to need to go through a lot of gloves. So I don't even know that, Monica will be able to speak more to this, but I don't know that we necessarily recommend that people be using gloves in that manner at this point in time either. I hope that answers your question.
I guess if you want to reiterate, with it, obviously we want to, I know you said like the Great American, Pickup Day, for example, is postponed, but is this something that people could do on a daily basis by themselves?
Absolutely. So kind of what I touched on earlier, generally speaking, even when it's not a pandemic, you don't want to be picking up litter and then touching your face and not washing your hands. So we do still encourage people to go out with, the people that they live with, the people that they're sheltering in place with, to pick up litter. Be sure that you're washing your hands afterwards and not touching your face. The real problem with our community cleanup events is the gathering of people. That's what we're trying to avoid there.
Do you recommend when people go out on walks? I know parks are closed right now, but if they're just walking on the sidewalk and they see some litter, are they really encouraged to just still go through and pick that up?
So we're really telling people it's what you're comfortable with for something like that. If you're not out with the explicit purpose to pick up litter, if you're not prepared, you don't have something to maybe set that piece of litter in, you don't have hand sanitizer on you, we understand that at this point in time it's a little precarious and maybe not everyone is looking to be doing that as they maybe normally would.
Thank you.
Are there any other questions?
I've got one for you, Monica. There's no other question for the other speakers.
No.
Earlier today on a local television station, there was a report that people would be eligible for COVID-19 testing at East Bluff site even if they were asymptomatic. I
So the question is, there was an earlier report about East Bluff accepting asymptomatic individuals for testing. And I think the confusion laid on the fact that the groups that used to be prioritized are no longer being prioritized. But individuals still need to have COVID-like illness symptoms. So again, whether it's a cough, sore throat, shortness of breath, fever, aches, headache, some muscle aches and chills, all of those are COVID-like illnesses. And so we want to still have symptoms for the test sites, but we no longer, for the federally qualified health center, as well as the community-based clinics out in McLean, we're no longer requiring that you be living in temporary shelters or be a person of a certain age with comorbidities. So a great example would be if you were 51 years old and you lived at home and you did not work in the essential service field, but you had COVID-like illnesses. Previously, those test sites were limited to you, but now those are available for you. So if you have COVID-like symptoms and you're able to self-administer, meaning that you're able to properly get the test done to you without having necessarily an individual to support you, then they're recommending that you go to any of those community-based testing clinics, as well as 3 sites that Heartland is now operating.
So at this time, if I show up to one of the testing clinics and I don't have one of those symptoms you described, the fever, the cough, I will not be allowed to get a test?
No, you would not. The question is, if you don't have symptoms, will you not be allowed to have the test? Not necessarily. They are going to still assess you at that point and understand what other possible situations you might have. A lot of people are still focused on that fever or in that cough, but really we're seeing more and more that there is a variety of symptoms that are attributed to this. So Heartland still recommends that if you think that you've been exposed and you're having some mild symptoms, but not necessarily what you thought were those kind of heavy hitter symptoms we were talking about early on during the response, still go and get tested. It is an opportunity for you available. But in terms of just being asymptomatic, again, not necessarily worthwhile to get tested, because as we talked about, you really want to have a viral load, because again, this test is going to determine that you have the virus or not. It's not going to say whether you had it previously or are you going to get it, but at that point in time, whether you have the virus.
And I know at this time, yesterday there was 147 tests used. Today it was 150 before, I think it was before 3:30 even. So, there's obviously, like the chairman said, a pent-up demand for this. If you had said that, the levels of tests available could fluctuate based on what the state provides and what the demand is there any talks about getting more than 150 tests at the East Bluff site, at least until, some of the other test sites come online?
So the question being, is there ability to expand testing at those sites while other ones come online? And I think right now this really is week 1. Every day we are amazed to see the response for all of those tests. And so I think where the state is working closely with Sharon Adams and Dr. Stoner from Heartland Health Services to assess. And we've actually already requested more test kits to come into our community, not just for Heartland Health Services, but for our hospital systems as well. And so, again, we want to make sure that we are getting the supplies in. Because I know we've talked about this a lot, about confirmed cases in our community, right? And as I mentioned before, Peoria County today sits at 46 confirmed cases. But because we were prioritizing testing initially to those high-risk groups, a majority of those tests are for those priority areas, especially individuals in congregate living settings. So 50% of our positives are coming from congregate living settings. That's a very specific population. So by expanding it and taking out those priority groups, but just saying anyone with symptoms that is able to get tested, come and get tested, we're going to get a better understanding of the general population's level of this virus, because now that allows our testing to be expanded, and now more general public individuals will be available to get tested. So this is a really good thing.
Monica, with 150 tests per day per site, is that more for just quantity control, so that way you guys aren't going through 400 different tests a day? Is it just quantity control?
So the question is that limit because of just controlling quantity, or are there other things? I think there's a multitude of aspects. One was just understanding what the demand in the area was going to be, but also recognizing that while there is staff that's collecting the test, there's another entire group that's actually doing the laboratory work behind it, and they can't get flooded. Because we saw early on when we had testing and we didn't have a lot of our labs up and operational, that the wait time for results could have been up to a week. So we're trying to balance the number of tests with making sure that we have a quick turnaround time as well.
What is the turnaround time right now?
The turnaround time is anywhere from 24 to 48 hours. It depends on when the courier gets the samples to the site and they can start processing.
Have we gotten any tests back from this testing yet?
When I checked at noon, not yet, but I recognize the fact that the courier was doing a morning and an afternoon shift yesterday, and so even if that morning shift was started, we would not start getting those results into our system by most likely this afternoon and evening and into tomorrow.
So we'll probably start seeing them tomorrow.
We hope to start seeing some of them tomorrow if we do have positives. Even our negatives we're hoping to see tomorrow as well, and our goal is to actually be able to announce how many we're getting in from specifically from the Heartland test site.
Say at this time from the Heartland test site, I mean, where the people who are taking advantage of testing are actually coming from? I mean, do we know like what zip code, what city, what county? Because I was under the understanding that this was open to the whole region, so Tazewell, Woodford, even McLean, if you wanted to come over here to do that.
So the question is from the Heartland test site, especially yesterday, do we have any data from that? They do have data. They're processing it right now because it was not done electronically. It's manually done. Someone's entering it back at the state office, so to speak. But just from their brief interpretation, they think over 80% were Peoria County residents. They did see individuals from Washington, Morton, and Pekin areas, so we do know we're getting people from our surrounding areas as well. Majority were from our area, and I think they said about over 50% were Heartland patients themselves. So again, we are getting that group that Representative Gordon Booth was really focused on making sure that we were addressing, that we wanted to make sure we were getting it to those underserved communities, and it looks like that the site has been able to do that, at least day one. Again, we're going to see more data today, and Heartland Health Services, along with the health department and other community partners, are actually doing daily briefings just to kind of get that understanding of where we sit in terms of demographics.
Monica, can you confirm if there's any positive cases at Headington Oaks in employees or residents?
Not that I know of. I can't confirm that. I know there was some concerns about, we also got news about staffing changes and things of that nature, but again, want to reiterate the fact that our long-term care facilities, we work very closely with them, and we recognize that staff work in multiple locations. And so, again, one of the things that we were very upfront with early on in Peoria County was that when a long-term care facility had any positive case, that we were informing all of it as an entity so that they can work through their HR processes with that due diligence. But again, from what I last saw at noon, I did not see any confirmed cases from there.
So then, like you said, I know you've talked about this before, but if you could reiterate kind of what that protocol is, then if, for example, hypothetically speaking, you have like a nurse that may be working at multiple facilities, kind of how does that work in terms of tracing and, contact with different patients, et cetera?
So the question is, if we have a staff individual or any contact individual that works at one long-term care facility, how does that happen when they have been identified as a possible contact? And so our staff immediately works with that individual to understand what their risk was. Were they working that day? Were they exposed to that case? Kind of understanding, again, were they intimately involved in the care, or were they maybe an individual in the main office as a secretarial position, right? And so we want to know what that risk is. And then based on that, we ask them about their symptoms, whether that not they've been masking. Because remember, our healthcare providers, they're going to be in contact with a lot of positive cases, even our hospital system. And so that's why they've all adopted universal masking as a protocol, just natural part of their response efforts. And so whether or not they were doing the proper PPE, and then based on that, they may be able to continue working in that scope, or they may be asked to self-isolate and quarantine if they have symptoms or if their exposure and they didn't have proper PPE. Now, in terms of different entities, again, people working at multiple locations, what ends up happening is really early on we ask them from an HR standpoint, understanding limitations of staffing, that is really up to them and how they want to operate and work between themselves. So some locations say, hey, if you're coming from a site that has a known positive, we're going to ask you not to work that week. Other locations can say, we're doing universal masking, we understand that risk, but we've also put into policies extreme control methods. And so really it's by each agency, and we're just really providing them technical support.
Now that we have more testing, some of those people that, like at Bickford, that are presumed positives, are they going to be tested more readily now?
So the question is, if someone's a presumed positive, will they be more readily tested? That is always an option for them. At the same time, depending on their care, whether bring them out and getting to a test site location is worthwhile for them is also going to be a limiting factor. And so, again, with more testing, we're going to get a better understanding of our confirmed cases versus just presumed positives. But knowing how this virus works, how contagious it is, really, if you've been in contact with an individual and you start developing symptoms, it is really highly likely that you are positive for it. And so a test will not necessarily change your clinical care, but if it does, it might be important for you to get that done.
Would you suggest to family members if they have a resident, if they have a family member in a nursing home that is having, even some mild symptoms, to get them out and get them to one of these testing sites?
So the question is, if you have an individual, a family member that has symptoms at one of long-term care facilities, to remove them from that site to go to a clinic. That's going to be a question between that individual and their healthcare provider. And again, you want to weigh risks. Taking an individual out and putting them in a setting where they may be exposed to other items, even COVID necessarily, where they might be had a different illness in the nursing home. If it changes their care, then it might be something to consider. But if it doesn't, you're putting additional risks out there. And again, you want to limit. We understand that our congregate living settings are those vulnerable populations. So that's why they have those high restrictive policies, and they've had them for weeks on end now, because they're trying to do that type of control.
On Monday, the governor talked about a program where he's going to start sending groups of testers to nursing homes that don't have any positive cases in an effort to kind of get ahead of some of these outbreaks. Mm-hmm. Do you have any idea when that's going to start happening here?
So the question is about the proactive approach the governor is addressing in terms of testing long-term care facilities that do not have any positive cases or presumed cases even. And we understand that there's going to be 50 establishments that have been on the first round. We don't know if any of ours will be. At this time, we as local health departments are waiting for further guidance from the state on that. But we do know of it, and again, it's really focused on the fact that we're seeing a lot of asymptomatic individuals. So people with very, very mild symptoms, or really not showing that many symptoms at all, are the ones that we see a lot of transmission in. And so that proactive approach is really to address our vulnerable populations in congregate settings that are asymptomatic. And that's really what the focus is. Again, to really focus and have kind of a specific approach in those areas.
Will you get a heads up before they come down here? I mean, will you know very far ahead that they're coming, or are they just going to show up one day?
So we hope to have a heads up, so to speak, whether or not they're using one of our facilities in our communities. But Illinois Department of Public Health has been really open to us about this dialogue, and so I suspect that we will get notified, whether it's a week ahead or 24 hours, I can't tell.
Statewide data for the first time on the number of healthcare workers who have tested positive for COVID-19, number of healthcare workers who have passed away due to complications. I mean, I think it's 2,500 statewide and 8 deaths. Do we have that information locally, and are there plans to, eventually release that information daily along with the other statistics and numbers released?
So the question is about healthcare workers and the data on how many have been affected and how many actually have passed away of the virus. We collect that data, each health department does, because it's one of our tracking early on in the response efforts. We were actually tracking contact, travel history, and healthcare worker exposure. We're all one of our main contacts. As this became more community-wide, those requirements for posting that was not necessarily fulfilled by all health departments equally. We at Peoria County have been keeping track of that. Our concerns moving back is going to be similar to some of the long-term care facility concerns, is that some of what we're posting, we want to make sure that the definition aligns with what the state definition is as well. Meaning that if you have a long-term care individual or a healthcare worker that received it through travel, are they a travel contact or are they a healthcare worker contact? And so we want to make sure we understand how we are calculating that definition so that those numbers reflect the true accuracy of what the intent is, which is how many healthcare workers are exposed within the field of work.
Monica, kind of before all of this started, I remember doing interviews with, nurses and doctors about flu season and how it was, a pretty heightened flu season. Do we have any kind of comparison in numbers right now as to the number of, influenza cases versus coronavirus here in Peoria County?
So the question is about influenza and how it compares to COVID-19. The Peoria City County Health Department works with our hospital systems, and we actually, during flu season, we monitor the number of tests that come back for type A and type B positives. as quick flu, and we actually report that on our website on a week-to-week basis. What's really difficult is you have to also recognize that flu season is, we report off of a calendar year, and flu season actually covers 2 calendar years in essence, and so it's not a perfect matching aspect to it. Having said that, I think what's really concerning is that as we move into the fall, how this virus progresses on top of having influenza is going to be, I can tell you right now, the number one thing you're going to hear me say come the fall is, if you're able to, get vaccinated for flu. And the reason why is because, again, you want to decrease the pressure on our healthcare system to deal with influenza illnesses. But likewise, if you've had influenza vaccine and you're coming down with symptoms, it's going to help your healthcare provider understand what possibly can also be involved. And so I'm going to start it today. I know I'm already a couple months out, but come this fall, if you are able to, get your vaccine for flu. It's very important.
I apologize if you've addressed this already, but people showing up to these testing sites who don't have symptoms, are they just being turned away, or how's that kind of thing dealt with?
So the question is, if you don't have COVID-like illness symptoms and you're coming to these test sites, will you be turned away? And no, you're going to still be assessed, because they want to understand that you self-diagnosing yourself as not having symptoms is a little bit different than a healthcare provider. So we still want you to have that communication with the nurses that are available, and also those intake staff that are trained to kind of ask a little bit more probing questions, because you might feel fine today, but you might think that I've always had this sore throat, but that's allergy time, and you're not registering that as a symptom, but they might be registering that as a symptom. So we don't want to turn people away, but again, focus on the fact that if you're symptomatic, you don't have to have the really high fever or a really hard cough. You just want to make sure that you have those symptoms. Please utilize those community-based testing clinics as well as Heartland.
When you say assess, do you mean like your temperature's taken, questionnaire? What kind of goes into an assessment?
So the assessment is really, as part of this test site, is going to be just a screening. We're not taking temperatures, but mostly a conversation to understand your health history.
And is it still recommended that if my symptoms are what are usually characterized as mild, that I first call my primary care provider or a telehealth service rather than just showing up at the testing site?
So the question is, do you need to call a healthcare provider or telehealth prior to coming to a testing site? And no, for the Heartland Health Service Clinic as well as a community-based clinic, you do not need a physician referral. You can show up to that. Now, mind it, when we are going through the process, we do ask you who your healthcare provider is, so that from your results, we can share it with them, so that they know that, oh, Monica came through and Monica tested positive for COVID-19. And then my healthcare provider would work through with me. Because we're doing this through Heartland, there's a good chance that you're going to be reached out by Heartland Health Services to make that initial contact.
So there's no recommendation that I first contact a doctor before showing up. I can just come out even if my symptoms are mild, like I've had a persistent sore throat or a mild cough.
So I think, to clarify, you don't need a physician's referral to come to the testing site. You can come on your own. But if you've been having mild symptoms, please utilize your telehealth services, because we still want you to have that communication with your healthcare provider. And the healthcare providers in our community are fully aware that Heartland is operational and know it is a resource. And so they may refer you to that site as well. But you do not need to have necessarily a physician's referral, but definitely utilize your telehealth services if you have questions. Well, thank you, everyone. We will see you guys tomorrow.